My name is Thérèse McDonnell and I'm going to present to you some of the findings from the CUPID study. Specifically, I'm going to present how the policy of free GP care for children aged under 6 impacted attendance at general practice, out of hours and emergency departments. By way of background, Ireland is the only EU country that does not have universal health care in place, and the majority of the population pay high out-of-pocket costs for accessing GP care. In the 2011 programme for government, the government set out its aim to introduce GP care free at the point of use for all. In 2015, GP visit cards were extended to all children aged under 6 and to those aged 70 and over. So by 2016, 36% of the population had access to free public health care through the ownership of a medical card, while another 10% had access to free GP care through the ownership of a GP visit card. In 2017, an all-party commitment to universal health care was stated in the Sláinte Care programme, and part of that programme was the aim to introduce universal GP and primary care for all. However, the ability of general practice to absorb increased demand is questionable. There was and is an undersupply of GPs practicing in Ireland. Demand is projected to increase substantially over the coming years, and over a third of GPs in Ireland are aged over 55, some of whom are unable to retire due to the lack of a replacement. Out-of-hours services in particular have been highlighted as being in crisis. Indeed, evidence from other countries following the expansion of health insurance or the reduction or removal of fees for accessing healthcare supports the expectation that demand would increase following the removal of a fee to access healthcare. One study using data from a number of North County Dublin GP practices and an out-of-hours services serving the same area, did find in the year following the introduction of free GP care for children aged under 6 that attendance by this cohort increased at daytime services by almost 29% and out of hours by almost 26%. And just by way of a further comment, the budget for 2022 has now introduced a plan to extend free GP care to children aged 6 and 7. So CUPID began to recruit general practice and out of hours to our study. We recruited 39 practices across Ireland initially. However, the COVID-19 pandemic placed significant pressure on GPs, so just 17 of those who had signed up continued with our study. 16 of these had data suitable for inclusion in the study, and these 16 were located across 12 counties. We also have in our study a large out-of-hours service that provides cover over our 5 years of this study throughout 6 counties in Ireland. And finally, we recruited 5 hospitals to the study. 3 are the Children's Health Ireland at Crumlin, Tallaght and Temple Street, located obviously in Dublin. And then we have Cork University Hospital and Limerick University Hospital. We gathered anonymised retrospective visit data for children over a 5-year period. From GPs and out of hours, these children were aged 12 and under, and for the EDs, they were aged 15 and under. How do we estimate the policy effect? Well, we looked at the trend in monthly attendance by children aged under 6, and we compared their attendance over time, pre and post policy, to children aged 6 and over. This methodology is called difference in difference. We had therefore 2 years pre-policy, which allowed us to check if attendance patterns over that time frame were comparable between the under 6s and the comparison cohort. And we then had 3 years post-policy, which allowed us to assess if the impact varied as parents and GPs adapted to the policy. We had to adjust our estimates for variation in population trends over the 5-year period, as the number of children aged under 6 was decreasing year on year, and the number of children aged over 6 was actually increasing. We firstly turn to the impact of the policy on general practice attendance. The graph on the left-hand side here shows on the y-axis the number of visits for the practices in our study, and the x-axis is the age of the child. The lines that are dashed indicate the 3 years post-policy, while the solid lines are the 2 years pre-policy. On the right-hand side, we see another graph that is the mean monthly attendance at the average practice over the 5 years of the study period. We calculated that the increase in attendance at general practice that was attributable to the policy was between 20.1 and 21.8%. We also calculated that there was an increase in the number of patients aged under 6 attending, ranging from 7.3 to 19% in the 3 years post-policy. However, there was a partially offsetting decrease or decline in attendance due to the reducing population of children aged under 6. Turning now to the impact of the policy on out-of-hours visits. On the left-hand side here, we can see that 3 years post-policy for the younger children resulted in increased attendance at out-of-hours. And looking at the right-hand side, which shows us the mean monthly visits for the average centre within out-of-hours, shows that the red lines, in particular the dashed lines, which both represent the under 6 cohort, and the dashed lines are the attendances adjusted for population movements, increased post-policy. The increase attributable to attendance at out-of-hours was 17.5% in the first year post-policy, ranging to or increasing to 24.4% in the third year post-policy. It's also worth noting that attendance did increase for the older cohort. However, again, population changes due to the decrease in the number of children aged under 6 did partially offset this increase. ED referrals was also of interest to us, but unfortunately we did not have this data available to us from the GP practices in our study. However, we did have it for the out-of-hours cohort. And this graph here shows with the blue line indicating children who are age 6 and over, and the red line indicating children who are under 6, the proportion of visits to the out-of-hours service that end in a GP referral. And we can see that from the second year of the introduction of the policy, both cohorts saw a significant increase in the rate of GP referrals. With regard to the impact of the policy specifically, there has been limited impact directly attributable to the policy. Overall, a relatively small portion of children are referred to the ED, approximately 1 in every 20 visits. The referral rate for older children aged 6 to 12 is approximately 1 percentage point higher than those aged under 6, which probably represents or signifies the proportion of low acuity presentations by very young children. And there's a general trend of increased referral rate for both cohorts, which may be indicative of the pressure on the out-of-hours service. Turning then to the emergency departments and their impact on the departments who are participating in our survey, our study, we can see here on the graph on the left-hand side, again, the red indicates children aged under 6, that there's been a slight increase in attendance at emergency departments and certainly no decrease. So there's no evidence that the emergency departments are seeing fewer patients following the introduction of this policy. So ED attendance by children aged under 6 has not decreased. When we look at the proportion of attendances that are referred by GPs as a total of the overall visits, we can see here that the proportion referred by GPs for children aged under 6 has actually increased following the introduction of the policy, while the proportion of visits by the older cohort arriving at the ED that are GP referred has actually decreased. However, the effects did vary by hospital. For example, one hospital in our study that was located in an area with known GP shortages, following the introduction of the policy, saw a decrease in the proportion of visits to the ED that were referred by general practitioners. This decrease may be indicative of the inability of some patients to gain access to GPs in the area following the introduction of the policy, and therefore is indicative of supply constraints within general practice. To conclude, the introduction of free GP care for children aged under 6 did increase attendance substantially at general practice and out of hours. However, there's no indication of any reduction in emergency department attendance. At a time when supply of general practice care is under pressure, the government's policy of expanding demand is likely to have generated bottlenecks. We would suggest that a more integrated policy of boosting supply as well as demand is needed. Should you be interested in reading further research by the CUPID team, I have placed our web address here on this slide, so please do take a look. Thank you.